Good morning, my dear friends and participants of this video. This video is intended for forensic medical experts, forensic medicine going MBBS students and PG students. First of all, I am Dr. Balaji Singh, Professor of Forensic Medicine, ACS Medical College and Hospital. This video made for how to reconstruct a scene of offense. I will narrate few scenarios of crime scene, some of the accidental, some of the suicidal or self-harm, some of homicidal. First, I will tell one scenario. One young fellow, 30 years old, found his bedroom with a pool of blood. His clothes are intact. His clothes are intact. No cuts over the clothes. Body found in front of the mirror. His history of taking some antidepressant tablets for few years. He is separated from family and has having a previous attempts of suicide. On postmortem examination, the incised wound, clean cut incised wound over the left left aspect of the neck, extending from forwards and downwards. Some small cuts also present in the beginning of the wound, and on examination, uh, left hand front wrist showing some small healed scars of incised wounds. This is the scenario. Injuries, I am emphasizing few points. Injuries present over the neck, some small cuts. Only one deep injury is present over the left aspect. He is a right dominant hand person. Previous history of depression. That is one scenario. And his body found his own bedroom in front of the mirror. This is the scenario. You will go for next case. Body found on the next to the railway track. The head is inside the track and whole body is outside the track. Sparingly, some of the dust particles and blood particles and grease particles are contaminated to the neck and head. He is also having a history of depression and previous suicidal attempts, and no suicide note is found anywhere in his pocket or somewhere. But no other injuries. During postmortem examination, no other injuries found over the railway track incident body. It is a clear severage of separation of head from body. This is another scenario. What is your opinion in these two scenarios? These two scenarios are clear-cut case of self-harm. Stomach may contain any poison or may not. Sometimes some alcohol may present in stomach contents. Sometimes any antidepressant tablets or overdose may be present in the stomach. So these are the scenarios of clear-cut scenarios of self-harm or suicidal case. Where in asphyxial deaths, where we can find a partial hanging, also a clear-cut case of self-harm. Similarly, in poisoning, organophosphate poisons are some of the self-harm. Usually, organophosphate poisoning is self-harm. Next, partial hanging, already told. some of the well educated persons, some who is having some luxurious life, such persons also is sometimes committing suicide by atypical means. For example, they produce in a closed environment by partial combustion carbon monoxide. For example, igniting something and pouring some inignitable materials like Coca-Cola and all organic materials, they are producing carbon monoxide, so that in the closed environment, the carbon monoxide is having no smell, no odor, no pungent irritation, nothing, but just confusion and causing coma. In such case, smooth death by self carbon monoxide poisoning. In such a case, hypostasis is pink in color. Next, one more case. There are multiple chop wounds over the back of the head, multiple chop wounds over the back of the head, body found next to road. What may be the cause? There are multiple, more than four, five deep gaping chop wounds, even involving into the scalp, skull, and some injuries are in deep of brain depth. So brain is somewhere is exposed. Such a multiple injuries in over inaccessible part is more prone for, is suggestive of homicidal in nature. Next. Usually self-harm injuries or deep injuries are one or two associated with hesitation cuts. But in self-harm injuries, I found some cases without hesitation cuts because they are under the influence of alcohol or some designer drugs, so that they never hesitate to cut down their neck under the influence of alcohol. So in such case, they are much intoxicated or influenced by some strong drugs like alcohol, designer drugs, MDMA, ecstasy. I found some of the fatal injuries over the body without any hesitation cuts. In such a case, usually clothes are intact. Sometimes body may be found nude. The cause of death may be due to hemorrhagic shock. Coming to the next, accidental. Accidental deaths are so many. Usually, road traffic accidents are accidental. It is very difficult to cause homicide by road traffic accident because there is no guarantee of death in road traffic accident. The successful attempts to kill a person by road traffic accident is not a common practice. There is no guarantee of accident. There is no guarantee of death. If he survives, definitely he will narrate the name of the accused in his dying declaration. So it is not a routine practice. Even homicide by snake bite also is not a routine practice. Accidental deaths, it may be fall from height. Recently, I attended Vizag for exam duty. There, my friends narrated one scenario. A young girl, unmarried girl, is fallen from rooftop of third floor. She is attempting to um, making dry the clothes. While the process, she reached the edge of the building where the parapet wall is only hardly 3 feet height. From there, she attempted to make the clothes to dry, Then unfortunately, because of wet land over the rooftop and with loaded with fungus, it is very slippery. So uh, if you are not taking care of the edges of the heights, definitely there is a chances of accidental fall. Young girl, unmarried, sustained injuries because of fall from height. I want to emphasize one more case. A chain snatcher in Tirupati, he jumped out of a 20 feet height after snatching a gold chain from a woman. He is only 30 years young adult. After jumping, he stands still on his feet. He hasn't sustained any injuries or any fractures or any external injuries. No bleeding, no fracture. Unfortunately, within few minutes he collapsed. Before reaching hospital, he died. During postmortem autopsy, we found mediastinum is full of blood. After thorough search for source of bleeding, we found a tears in arch of aorta, a point where the junction of arch of aorta and descending aorta, whereas the free part and fixed part. Let me explain the mechanism of arch of aorta and descending part anatomy. Arch of aorta is a free part, whereas fixed part. If any traction in between in this junction will prone for horizontal tears in aorta. Basically, heart is not supported beneath, underneath. It is a hanging apple. Any jump from height, the heart is pulled downwards. Heart is pulled downwards. In such case, the aorta is prone for uh, tears. In same scenario, when we are moving in roller coaster after full stomach, our intestines are prone for traction. Whereas duodenum also is having such fixed part and free part. So intestines also prone for tear in vigorous movements after full stomach. It's not comfortable. In this case, the cause of death is internal hemorrhage because of bleeding from aorta. It is purely accidental. And cafe coronary choking is purely accidental. Unfortunately, my younger brother, 42 years of age, he succumbed because of choking. He has having a habit of some alcoholism. Uh, in afternoon, it is vegetarian meals only. Only a rice particle is trying to enter into the larynx, but the vocal cords are shown sustained spasm. So, sustained spasm more than 3 minutes will cause choking, respiratory asphyxia. Asphyxial deaths due to choking is possibly purely accidental. That scenario cannot be created artificially. These are some of the accidental deaths. I want to emphasize one more thing. Injuries at hat line. Injuries at hat line is usually accidental in nature, whereas the injuries above the hat line is usually because of assault. Maybe lacerations or depressed fractures or any stab or any contusions are usually above the hat line is usually not because of accident, mostly because of assault. Whereas the injuries over the hat line is because of accidental. Somebody is falling on ground, eh, the hat line is affected. In motorcyclist fracture, the impact over the side of the head will transmit internally at the base of the skull, uh, creating transverse fracture through petrous part of the temporalis bone, and then shalla turcica, and extending on the petrous part of the opposite side. A complete transverse fracture where the upper part of the skull will move, so that it is called also hinge fracture also. Transverse fracture, and because of motorcyclists are more prone, motorcyclist fracture. This is cause of death because once petrous bone is fractured, there may be a continuous bleeding externally. So it is very difficult to control the hemorrhage, especially injuries of the facial bones and petrous bone. One of medical students has also died because of road traffic accident, because of facial injury in road traffic accident. Multiple, even after multiple transfusions, it is not possible. It was not possible to rescue him. He succumbed because of hypovolemic shock, hemorrhagic shock. So these are some of the accidental deaths. Homicides. Homicidal deaths are inaccessible part, stab wounds or chop wounds. Multiple nature is favor for homicidal deaths. Electrocutions. Electrocutions are mostly accidental. Suicides also possible. Suicides also possible in case of who is working in electricity department and they are having sufficient knowledge about electricity. So they can attempt for suicide by electrocution. So based on this knowledge, I want to conclude. Uh, these are some of the case scenarios in which you can assess the manner of death, that is suicide, homicide, or accident. Thank you. Thank you, my dear students and participants.